Today we'd like to talk about your choices when hiring mid-level providers. Nurse practitioners and physician assistants are often referred to as mid-levels. While I doubt that they find this to be a flattering or an endearing moniker, it is what it is. The long and the short of it is that practices all across America are trying to hire these mid-levels. Last week alone, we started the credentialing process for a new nurse practitioner who was working at one of our family practice client offices. 2 days later, we had another client ask if we knew of any nurse practitioners who were looking for a new opportunity. When taking on the search for a mid-level, our providers will oftentimes ask my opinion as to whether they should hire a PA or a nurse practitioner. My response is always only in regard to the billing differences between the two. In terms of education, training, and overall clinical skills, I don't feel qualified to respond. But in terms of billing, there is a difference. At least there is here in Iowa. Medicare and all of the private insurance companies credential both, and both are compensated by payers at 85% of the MD or DO allowed amounts for reimbursements. So there's no difference in the level of compensation. But there is one other difference. In Iowa, physician assistants are not recognized for credentialing by Iowa Medicaid. We've tried for years to convince Medicaid officials that they should enroll PAs in their program, but we've had no success. When we've worked in other Midwestern states, including Nebraska, Illinois, Indiana, and Missouri, their Medicaid programs have all recognized and accepted PAs, as well as nurse practitioners. So taking it a step further, the only way a PA can get paid for seeing an Iowa Medicaid patient is to bill incident to an MD or DO. When this is done, the reimbursements are at 100% of the MD/DO rates. However, all patient encounters must meet the stringent and sometimes restrictive rules of incident to billing. The bottom line is that you first must determine how big of a role Medicaid patients play in the payer mix for your practice. Determine how important it will be for your mid-level provider to treat Medicaid patients. Then you need to research and understand the incident to billing rules to determine if it is practical for your physicians and PA to follow them. At all costs, you want to follow all of the rules and avoid what could be construed as fraudulent billing. If following the incident to rules is not a problem, the PA may be the right choice for you. If it is an issue, you'll want to go with a nurse practitioner. We hope this is helpful when making this difficult decision. And remember what we always say at Medical Billing Services: you practice medicine and we'll do the rest.